Hi, my name is Hunter Dennis, and my informative speech is going to be over avascular necrosis. Avascular necrosis is the decaying of the bone due to the lack of blood supply to that bone. It leads to tiny breaks in the bone or can lead to completely collapsing the bone. It usually happens in people in the ages between 30 and 60 years old. It occurs in all the joints, such as wrist joint, elbow joint, shoulder joint, hip, knee, ankle. There's a few things that cause avascular necrosis. The first is dislocating or fracturing the hip or any location will stop, could stop the blood flow to going to that joint that you've dislocated or fractured. This makes up 20% of people who get avascular necrosis is dislocating or fracturing the joint. Another is chronic steroid use or inflammation drugs. It makes up 35% of non-traumatic avascular necrosis. Another is alcohol. Alcohol, consuming it, excessively consuming it for multiple years can lead to fatty substances forming between your joints or in your tissue, which will actually stop the blood supply from going to the joint. Avascular necrosis doesn't have many symptoms. Like myself, I haven't had any symptoms when I started, and I started playing golf for Ranger, and it started getting worse, and there's nothing I could do about it. I tried going to a physical therapist, doing the range of motion exercises. I've stayed on crutches, anything that you could think of, and so I finally went to a doctor that could give me an MRI and an X-ray. We got into Scottish Rite Hospital, and they were able to be a great help in doing everything that they can to help me, but it's taken multiple months. Avascular necrosis, from the time where you actually start to feel it hurting to the time that you actually have to get a replacement or help with it, could be months to a full year. The treatment depends on your age, what stage the avascular necrosis is in, the location of where it's at, and how much damage has been done to the actual joint that you're having problems with. If it's caught early, you can try to get on crutches and try the range of motion exercises, and it could help. But other treatment, getting worse into avascular, can actually be, it has to be surgically, something has to surgically be done to help, such as stem cells or bone graft. Bone graft meaning taking a bone from your elbow and putting it on your shoulder, something like that, like a live bone that's not decaying that you can put in that joint and start the blood flow to that joint. Another is a full joint replacement, which would be a hip replacement or a shoulder replacement, something like that. And what I'm doing, which is an osteochondrograft, which is where they take a bone from someone else and they put it into where you're having pain, which me, it's my hip. So they're going to have a donor, have to wait for a donor, and then once the donor gets in, they have to deliver that bone to that hospital and then put it in the patient. I've experienced this pain for months and months so far, and it doesn't go away. It happens every day, and you can't get rid of it without having to actually have surgery. If you don't do anything about avascular necrosis and you just let it be, then something could happen, like having to have a full hip replacement and it getting worse and worse. So if anything ever happens, be sure to get to the doctor.